Hi, my name is Holly, and I'm a patient of Dr. Jacqueline. I've known Dr. Jacqueline for probably like 25 years, I would say, maybe 20 to 25 years. I've had Botox with her since then until the lovely Kevin came along, and then I had it with Kevin. But as you can see right now, I just recently had an upper and lower bleph with a temporal lift and fat injection. So it's been several years, probably I'm going to say 5 years that I've been thinking about doing it and talking to her about it and kind of getting, you know, after my Botox injections, I would always say I'm staving off. And then one day she suggested that I try CO2. And so I did CO2, and I did 3 procedures of CO2. So I did the first one, then about 6 months later, I did another one, and then I followed up a year later with another one. And I had that last one a couple of years ago. And since then, you know, and actually the CO2 was amazing. It really did help tighten up this whole area and my chest area quite a bit. But, you know, it still had extra skin. And so after the last one, you know, I didn't do it for like a year, thinking I'm just going to kind of see. And then, the laxity kind of started coming back, and I saw her again for probably Botox, and you know, she had suggested, you know, what would really be good for my facial features and what I was trying to attain. And so I had taken a lot of time to get ready to do it, and even when she came up with the suggestions, I still, you know, had to take like a good, you know, month or two to think about that, and if I was ready, because for some reason, I don't know why, because it's irrational, I was definitely very nervous about it. And I think the thing that I was most nervous about was just going under just general anesthesia. I think that was my main thing, because I wasn't adverse, because I'd actually had a blepharoplasty done before in 2009 with a different doctor. And so I kind of knew what was to expect, and then having CO2 treatments, I kind of knew like just what the recovery is on all of that. So I don't know why, again, I have no idea why, but finally I decided to go ahead and do it. And so when she made the suggestions, it was an upper and lower blepharoplasty with the temporal lift with the fat injections, and then also a facelift, because it was a neck lift. So neck lift with the facelift and CO2. So it's quite a bit. We talked about it, and she kind of took a look at what she wanted to do. She called me a couple days later and thought, you know what, how about if we break this up into 2 surgeries instead of doing it all at once? And I was like, I think that's a really good idea. And so I'm really glad I did do that. So this is day 6. I had it done last Tuesday, and then this is Monday. And then Wednesday, I'm going to go in for the second half of the procedure, which is going to be the neck and the face and the CO2. So yes, so this is day 6, and I'll have to say that the second blepharoplasty, since I did have one like 17 years ago, whatever, I had told her, and that was part of why I think we also decided to break it into 2, because I told her I swell a lot, and I was probably swollen. I swear my eyes were practically swollen shut, and I swole up it was at least a week of swollen. And this is day 6 right now. So, and this, I mean, you can see a little yellowing right here, the bruising, but that's it. Like, this is as dark as it got. I really think the protocol that she has you follow prior to the surgeries really helped, because I had hardly any swelling. I also was amazing. The first night, I think is always going to be sort of the hardest, especially for that first procedure. So they have a service, Adina, and you'll probably have met her, but Adina is amazing. And so I hired her for the first night, and that was very helpful. She was Johnny on the spot with all of the icing and my meds, which I kind of like to have the medication. I like to stay in front of any type of pain. So I probably took the meds for a couple days, but after that, so today's Monday, I'm going to say starting on Friday night, even Friday, I think I was just Tylenol. And then starting Saturday was nothing. So I haven't had any Tylenol or any of the narcotic, nothing since last Thursday. And not bad at all. I mean, no pain. It's kind of weird, but no pain at all since, when I came out of anesthesia, I had some, but then they gave me some stuff and then I was fine. And I don't even now, I got the stitches out today, and I wouldn't say it's painless getting the stitches out, but it wasn't painful at all. It's just fine. And I don't feel like I need to take Tylenol or anything. I'm just really amazed on the difference between when I had it before and this time. It's been good. The worst part is the goopiness you have to put in your eyes a lot, and you can't see. So don't plan on texting or anything. Yeah, I'm very happy with the first part so far. I'm not really, I'm a little apprehensive for the second surgery on Wednesday, but not really, because knowing after this, it really, everything went just beautifully, and they took care of me so well. So hopefully you'll be able to see how I look, because I'll be in Thursday, and I'm sure they'll take photos, and so take a look. I'm kind of excited to see if I have little swelling. They'll have the CO2, so I'm going to be kind of red from that. But follow my journey, follow the whole thing. I think it would be really fun, and I'll let you know. Thanks.